Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
For those living with diabetes, managing their disease is an important step to maintaining or improving their health. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral medications may play a role in your treatment.
Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin. While there's no cure for type 1 diabetes, new technology is improving treatment for type 1 diabetics. Here to discuss new diabetes technologies is Mayo Clinic endocrinologist Dr. Yogish Kudva. Welcome to the program, Dr. Kudva. It's nice to meet you.
Same here. Thank you, Tracy.
So the treatment is different, certainly, for type 1 diabetes versus type 2. Explain for us.
So in type 1 diabetes, individuals who have the disorder do not have the ability to make any insulin of their own. So they're completely dependent on insulin being provided from outside. The way that is done is usually with 4 to 5 injections of insulin a day, or by using an insulin pump to actually deliver the insulin. When an insulin pump is used, the insulin can be delivered all the time and also at the time of eating a meal.
So with type 2 diabetes, these patients then have insulin?
Yes, they are able to make at least some insulin. Now, the ability to make insulin decreases with time. So with individuals with type 2 diabetes generally being diagnosed, let's say, 4th decade, 5th decade or so, and now living for several decades, it's very possible that ultimately they'll end up with making very little insulin.
Do we know what causes type 1 diabetes?
Yes. In most individuals with type 1 diabetes, about 80% of individuals, we are able to test them for certain antibodies. So these antibodies are to certain proteins. And there are 4 different proteins that have been identified that they could have antibodies to. So if we did the antibody test, about 80% would rule in positive for these antibodies. And so then we are left with another 20% where either there is an antibody, we just don't know against what protein it is, or truly it is immune mediated and it is not associated with antibodies, or the third explanation is it's some other kind of diabetes and we still don't know. So I just want to return for a second to the issue of the ability not to make any insulin. Mm-hmm. So when we try to manage these individuals with type 1 diabetes who don't make any insulin, it's very difficult to mimic what the body does. So with current such technologies, insulin pumps as well as injections, when patients test their glucose 4 to 10 times a day, 50% of these readings are below a number such as 70 and above a number such as 180. And I use these numbers because these are generally accepted numbers for good control. In the last 18 years now, we've had a continuous glucose monitoring technology which enables glucose to be checked every 5 minutes or so on an automated basis. Because of this ability to do continuous glucose monitoring, that signal can be used to change insulin delivery through an insulin pump. And that is the artificial pancreas system. So at this time, since March of this year, an artificial pancreas made by Medtronic called 670G has been approved and is available for clinical use. And it represents the culmination of about 40 years of research.
40 years of research. And so you're testing it with patients now?
Right. So at the moment, it is clinically approved. So certain patients could go ahead and have it through their endocrinology office by doing appropriate paperwork. But there is also a research study involving this, and we are a center for this research study. So we could enroll individuals using an insulin pump or using a pump and a continuous glucose monitor, but without the control algorithm, or those on injections. So this is a Medtronic-sponsored study, and we are a site for it, and there are several other sites around the country and the world. There is also competing technology for which we are also a site. So there are a lot of research opportunities now for patients, and the exciting thing about these opportunities are that by taking part in these studies, patients could have real treatment benefit.
And so you talked about this artificial pancreas.
Yeah.
What is that? Is it a device that's planted into the skin?
Yeah.
What exactly is it?
Yeah, that's a great question. So an artificial pancreas is a bit of a simplification because as we know,
I appreciate that.
as we know, the pancreas has got two parts to it. One part is the part that allows us to digest food, and the second part is the part that allows us to process and store the digested food. So the food is digested, and that results in an increase in the bloodstream of glucose and fatty acids and certain amino acids which make up protein. So with a meal, there is a part of the pancreas that releases insulin and other related peptides. So the insulin is the main mediator of this fuel storage mechanism. So in the artificial pancreas, as we use it for type 1 diabetes, there are two components. There is a component that is the continuous glucose monitor that checks the glucose all the time, every 5 minutes. And then there is the insulin pump that delivers the insulin. And then there is a control algorithm which takes the continuous glucose monitoring signal, including the current state of the glucose, the rate of change of glucose, and the prediction of what's going to happen to the glucose in the next 30 minutes or so.
Wow.
And use all of this information in real time to change insulin delivery. So that is the artificial pancreas system that we are using through Medtronic. If you read the popular press, they will also use another terminology for it, and it's called hybrid closed loop. So closed loop is just a terminology indicating that there are components of the system and the components are interacting with each other. So the loop is closed as opposed to an open loop where the components are given back to the patient to take a decision. Hybrid, the term hybrid is used because the insulin that is being delivered all the time is being modulated with this control algorithm, but at mealtime, the patient needs to get involved and needs to put certain information into the insulin pump in order to help control.
So Dr. Kudva, when you look in your crystal ball in the future,
Right.
do you think that this is the be-all and end-all, or do you think this is the beginning of another long 40-year journey? Hopefully not.
Well, I don't think it is the beginning and end all. I think it is the end of a beginning.
Okay.
And I think the beginning of a lot more sophisticated, things to come. For example, our experience with these technologies is quite short duration at this time. We have a lot of experience with the insulin pump use, for example, but can we use insulin pump for several decades? You see? So remember, insulin is usually released by the pancreas into the circulation in the abdomen. So when we do the insulin pump here, usually the insulin pump infuses insulin below the skin on the belly wall, or certain insulin pumps can be used at other sites like buttock and upper arm. And again, they would infuse the insulin below the skin there. So that is an unnatural site for insulin to be in. And with insulin, there are other diluents. And so there could be some changes that happen in the skin over time. So how long will this last is a question. Now, continuous glucose monitors are disposable. The probe has to be changed every 7 to 14 days. And it has to be secured in place with tape. And tape allergy is part of the challenge for modern day people. It's an allergies are part of our life, and so tape allergy is a significant part of the life of patients who have to use tape for everyday management. So one way forward has been for the continuous glucose monitoring technology to get less intrusive and for the patient involvement and patient burden to be less. So one solution for that is to have an implantable continuous glucose monitor. So there is one such technology being reviewed by the FDA right now. So the product is called Eversense, and the company is Senseonics. And what that will enable us to do is actually implant the continuous glucose monitor just below the skin of the arm. And then that is approved in Europe for 3 months. 6-month studies are going on. And the idea is this will go on for longer.
The future's not that far away.
No, the future is happening. And I think if there are patients listening, you can be an active part of it and you can help create it. So that's the vision here.
Talk to your physician.
Yes, absolutely.
We've been talking about new diabetes technologies for treating type 1 diabetes with Mayo Clinic endocrinologist Dr. Yogish Kudva. Thank you once again for joining us, Dr. Kudva.
And again, thank you for having me.